when you're traveling with your pets and they're not properly restrained, the injuries to humans and the threat to humans is also significant, and people don't think about it. And so I think it's important to get this message out there.
Hello, hello. Thank you so much for tuning back into VetFolio Voice. This episode features Dr. Elisa Mazzaferro, affectionately known as Maz, who joined me to talk about something that most of us encounter on a very regular basis, but if you're anything like me, may not have given much consideration, and that's pets and car safety. Maz drew on her years of experience in the ER and did a very thorough job of laying out the real dangers of traveling with pets unrestrained in the car. I know it definitely had me reevaluating my system of bringing my dogs with me in the car, which I have to say I do on a very regular basis. I was definitely rethinking things after this episode. And of course, being a veterinarian, my mind first went to the risk to pets, but Maz also reminded me of the very real risk that unrestrained pets pose to humans, and not just the humans that are in the car, but the surrounding vehicles as well. Fortunately, she also brought plenty of information about solutions. We talked about effective restraint devices that you can recommend to clients and tips on how to approach these conversations in a busy clinic setting where admittedly we have so much to talk about with clients on a regular basis. She really kind of gave some good tips for how to fit this conversation in there and not take away from the rest of our busy day. And towards the end of our conversation, I was really excited because Maz left us with some great resources on how to respond quickly when inevitably we are presented with these types of cases, and how to phone a friend in some of the more critical cases where we may feel a little out of our depth. I have to say, when I first heard this topic, I really wasn't quite sure what to expect, but it was a very helpful and eye-opening conversation, and Maz was great company. Let me go ahead and introduce her and let's talk car safety. Dr. Elisa Mazzaferro completed a residency in emergency and critical care at Colorado State University, where she also earned her PhD. She was board certified by the American College of Veterinary Emergency and Critical Care in 2002. She's currently a staff criticalist at Cornell University Veterinary Specialist in Stamford, Connecticut. She's also an adjunct associate clinical professor of emergency and critical care at Cornell University College of Veterinary Medicine. She's the immediate past president of the Veterinary Emergency and Critical Care Society and a past president of the American College of Veterinary Emergency and Critical Care. She's the recipient of the 2018 VEX Zaslow Distinguished Service Award. Dr. Mazzaferro is internationally renowned and a leader in her field. She's also a prolific publisher, having authored 4 manuals as well as numerous chapters and manuscripts on a range of topics relating to emergency and critical care medicine. She lectures extensively nationally and internationally, having given presentations in more than 21 U.S. states and 12 countries. She shares her life with a black pug named Minnie and 2 brachycephalic Bombay cats, Lulu and Bean, who actually joined us a couple of times on this call. All right, let's go ahead and get into our episode.
Looking to protect your canine patients against parasites? Look no further than Simparica Trio, Serraline Moxidectin and Pyrantel chewable tablets. The first chewable to offer triple protection from heartworm disease, ticks and fleas, and roundworms and hookworms. It's also FDA approved to block infections that may cause Lyme disease by killing deer ticks.
Use with caution in dogs with a history of seizures. Serraline belongs to the isoxazoline class, which has been associated with neurologic adverse reactions. The most common side effects were vomiting and diarrhea.
Visit SimparicaTrioDVM.com for full prescribing information.
Well, welcome everyone. In this episode, I am joined by Dr. Elisa Mazzaferro, or affectionately known as Maz, which I love. And she is a criticalist, and we're kind of covering a unique topic here, one that, certainly I think we're familiar with in veterinary medicine, but I don't know that we kind of talk about it in and of itself as its own isolated topic, and that's car safety with pets. So Maz, thank you so much for joining me.
Oh, thanks for having me. This is an important topic to discuss. And so, yeah, I love working with you and talking about it.
Absolutely. And I'm really excited just to hear your insight on this topic. And before we kind of jump into it, I'd love to hear just your background and how this became a topic of interest for you.
Sure. So, pet safety, and particularly traveling with your pets safely, is an important topic, I think. I've been an emergency clinician since 1997. So, it's a long time. And over that time, unfortunately, I've seen just a huge gamut of injuries sustained or medical conditions sustained when pets have been traveling with their owners, whether it's due to being in a car accident or environmental hazards like heat stroke or even frostbite and hypothermia. And so I think it's important to get the information out there and, as veterinarians, help our clients travel safety with their pets.
Absolutely. I think many of us who have been in veterinary medicine for any length of time have seen our fair share of vehicle related injuries and illnesses in pets. And you did a talk about this actually with Volvo,
Yeah.
which seems like a really cool experience. Can you tell us a little bit more about that?
Yeah, so Volvo approached Cornell. They have an amazing safety devices that actually can be incorporated when you purchase a vehicle and that's crash tested. And so they wanted to talk about traveling safely with your pets. And so they invited me to do a sort of a media blast, not specifically to talk about their technology, which is awesome. And I don't work for Volvo, so I can say that just experiencing it firsthand, though, things that people don't think about when traveling with their pets. And so I kind of investigated more. It's not only the injury sustained to pets, but when you're traveling with your pets and they're not properly restrained, the injuries to humans and the threat to humans is also significant, and people don't think about it. And so I think it's important to get this message out there.
Now you've really got my wheels turning because that makes a lot of sense. Something unexpected happens related to, your pet, and all of a sudden we've got, way more extensive injuries than just problems with our pets. So, jumping straight into that, can you give us some examples of some of the injuries you've seen related to dogs and cats traveling in the car?
Yeah, some things were pretty severe head trauma as well as spinal fractures. When
Oof.
animals aren't restrained properly, they get thrown into the windshield or the dashboard. I've also seen animals thrown from the cars and then get hit by other cars on the road.
Oh.
And sometimes the clients are also significantly injured. So we have clients going by ambulance to a hospital and they can't be spoken with if they're really injured. And then the police or first responders bring the animals to us to provide first aid. I've had animals where we don't know what their injuries are because they've run off into the woods on the side of the highways. And that just causes more stress for the owners who are trying to recuperate themselves. So the worst case scenarios, I have had animals pass away from their injuries, and just it's simple enough to restrain them if you have to travel with them. Restraint and putting them in a location in the vehicle where they're not going to be a distraction to the driver is the safest thing for both the pets and the pet owners.
And along those lines, thinking about human injuries secondary to animals being in the car, I'm picturing when you said you've seen animals be thrown from a car and then be hit by other cars, which is just horrible to think about. But I
Mhm.
also think about the human impact in those other cars because, of course, if you see a dog or a cat or any other living creature in front of you on the road, generally the instinct is going to be to try to swerve out of the way. And then we're
Mhm.
potentially creating a lot more dangerous situation.
Exactly. When animals are thrown from the vehicle, and like you said, our instinct is to swerve. And so it can cause a chain reaction of events. But also, when animals are sitting on their owner's laps, and if I had a magic wand, I would stop this practice right away because I see them sitting on their laps and they can get stuck. And I must admit, in the past, I speak from experience because I have pugs. They get stuck in between the steering wheel and the owner, and that can cause the wheel to jerk and then cause that car to veer into another location. Or they could inadvertently kick the gear shift and put a car in neutral and suddenly cause it to, maneuver out of the way or cause an accident. Yeah, it's really unsafe and it can be traumatic. Just witnessing it, even if you don't aren't involved in the accident, just witnessing it is very, very horrible for all of us, I think.
Absolutely, absolutely. For everyone involved. And kind of as we've illustrated here, that there's a lot of people who can be and potentially impacted by this.
Yeah, I see it every day.
Ugh. Well, talking about restraining pets and putting them in a place where they're not a distraction to their owners, what are some of the products that are available for pet safety? I have really spent a lot of time considering. I see pets come in with seat belts and things like that as part of their harnesses. And I go, oh, well, that's good that they have their pet restrained in the car, but that's about as far as I've really taken it myself. So I'm very curious to know what kind of products we should be thinking about and maybe what kind of products we should absolutely avoid.
Yeah. So I am a huge proponent of restraining pets in the back seat of a vehicle. This way, they're not going to either get hit with the airbag. If the airbag is deployed, similar to human babies, they can get significantly injured from that airbag, but also they're not a distraction as much. And so, in looking, I recently purchased two beautiful little Bombay kittens. And so, when I had to transport them home, I looked into products that are available. And the Sleepy Pod company makes multiple different carriers that all have been crash tested. And very few products out there actually have been crash tested. So, the Sleepy Pod company makes small carriers for small dogs as well as cats that are fantastic. The Sleepy Pod company also makes two separate harnesses. And when choosing a harness, I like a harness that's wide going under the animal's sternum and up over the back and around the neck. So they're secured and it dissipates the forces should they break suddenly or have an impact. So they have the Sleepy Pod company, they have two harnesses. It's a Click-It Sport Utility harness, as well as a Click-It Terrain harness that have little loops that you can also use for walking them. But any harness that you choose, the seatbelt should go through it. I don't like the harnesses that are attached to some length of a tether that are then attached to the seatbelt because it gives us too much room in between the seatbelt. So if you brake suddenly or are in an impact, the seatbelt engages to prevent anything from moving forward. But with that extra tether to the harness, the animal can still go forward and then get jerked back. Easy Dog Drive is also another harness that has been crash tested, I believe in Australia, but it meets US safety standards. If you have a large dog and you don't want to do a harness, then I recommend putting them into a carrier. And my dogs, they're small, but they're in a crate in the back of my car. And then I have that secured in the back so it can't move around. Should, God forbid, I roll over in an accident or something, the carrier and the crate are going to be stationary, so they're not thrown about the vehicle.
Sure, sure. That makes sense because, even just putting them in a crate, it's okay. They're restrained. They can't be jumping over the seats. They're away from airbags and they're not a distraction. But absolutely, depending on, the type of crash or something that there's the potential to get into, if that carrier gets thrown from the car, you might not necessarily be doing them any favors.
Correct, correct.
Does the Sleepy Pod, does that carrier for cats also secure to the car?
It does that. It does. It has a wonderful little Velcro strap where you can put the seatbelt through the Velcro strap, and it's very, very secure. I can hold it, and it doesn't come apart when I carry my cats in it as well.
Okay.
Yeah.
It sounds like a neat product. And it's good to, I think, to have product names because it's easy to
Mhm.
just kind of shop and say, okay, well, based on these guidelines, then there's these products available. But when you don't have a lot of familiarity, I think kind of knowing those specific products gives us a really good jumping off place.
The one good thing about the Sleepy Pod for cats as well, and some dogs, is that we've all experienced the cat that's so stressed out. They're being pushed and forced into a carrier and then stuck in a car, then brought to us for a wellness exam or whatever. And so the Sleepy Pod actually, the top detaches, you can unzip it and then zip it back in place. And so when it's not being used as a carrier, the cats can use it as a bed at home and get comfortable. And then should they have an accident in the car, number one or number two or whatever, it actually, the lining zips out and you can wash it. And so my cats, when they're not, being transported to the vet hospital with me for whatever reason, I keep it out. And a lot of times I find them sleeping in it because it's just their comfortable little go-to place.
Oh, that's so smart because, we talk to owners about that with their cat carriers of leave it out and spray it with Feel Away and put some treats in there and make it a comfy place. But it's still a plastic box in a lot of cases. Like a lot of
Yeah,
cats are like, nah, I'm not going in there. And so
right.
having the top zip completely off where it's this, like nice, comfortable little place they can sleep seems like a lot less mental trauma to those cats.
Yes, exactly.
I
Exactly.
love that. I love that. Feline friendly.
Hmm.
So, this is something thinking about talking to owners that seems important. I mean, I'm thinking of being the veterinarian who's recommending a recheck, and we have the owner bring the pet in, and God forbid there's an accident on the way and something happens to the people and to the animals. I mean, it seems like a natural conversation to say, hey, in order to bring your pet to see me, in a lot of cases, you're having to transport them back and forth. Let's talk about how to safely do that. Do you have any tips for client communication to kind of help that message land home?
Yeah. And so I really think this is an opportunity for a little bit of marketing as well as having little pamphlets. And so a great resource is the persons who see the animals come through the door. And sometimes our front desk staff are looking out the window. I'm like, oh my God, did you see Mrs. So and so? And they were running all over our parking lot because, Binky jumped out. And so they could take notice. Hey, I noticed that you came in without a carrier today. Here, let me provide you with some information because we've used these and these are great things to restrain. Because we would hate for whomever to get hit by a car in front of our hospital. And so I think that is an easy sort of non-judgmental, help me help you, help your pet type of way. And you can also incorporate other aspects of traveling with your pets in those safety brochures. And you can even make it and put it into an envelope where the client could have their medical records to carry with them should they be going on a trip and things to pack and process ahead of time. So it doesn't necessarily have to take up a lot of time in the examination. But for example, in the summer months here in Connecticut, we have a lot of clients that are traveling up to Martha's Vineyard or things like that. Or in the winter months, they're traveling to Florida because of snowbirds, or they're traveling out to ski and say, hey, by the way, are you traveling with your pet at all during this season? Hey, let me give you some information of tips on what to pack and how to process and proceed with that.
I think that makes a lot of sense. I'm picturing this, and it's kind of like what we're talking about here, where this is certainly something that's crossed my mind. I have seen vehicle related trauma in animals, but it's not something that really stays top of mind on a regular basis when we're in and out of a busy setting. And, it almost seems like something where you could maybe just put a sign up or something that says, are you traveling this season? Ask me more, or something like that. And it makes sense. It doesn't have to take up a lot of time in the examination, that maybe there could be an SOP that says, hey, if an owner is traveling, we give them this information in this envelope. Here's the records that we send with them. And then, just talk to the doctor to make sure, or have a qualified technician make sure we're checking with APHIS and all of that if we're crossing state lines and needing to be aware of anything like that. And something that would hopefully just not be something you have to remember to bring up in that examination, but that pet owners would say, hey, I saw your sign. Can you help me with that? And all of a sudden you've started that conversation.
Right. And I think that people are more familiar if they're traveling by airplane, but they don't think about it or think about crossing state lines with their pets. And if they're breaking any rules, I advocate for people making checklists. I make a list before I travel of all the things I need to pack, but they don't really remember about what to pack for their pets. And so making a list for them, do they need a health certificate? Well, you do for air travel, but you don't remember about going across state lines if they're just traveling for a weekend trip. But bringing enough of a patient's food so they don't get gastric upset, especially if it's a prescription diet. Having enough of their chronic medications so that they won't run out should their trip be delayed and they stay in the location longer than anticipated, especially in the event of an emergency or an accident, or even with any health issues, then having your pet's medical records, but kind of mapping out where you're going. And so both the Veterinary Emergency Critical Care Society, and I'm currently their immediate past president, and on the VEX Facilities for Certification Committee, there are facilities that have been certified with standards. And so you can look on that website to see VEX facilities maybe in a location of where a person is going, or the American Animal Hospital Association, which is aaha.org, also has this little screen where you can go, I'm going to Seattle and I want to see all of the emergency hospitals within a 20-mile radius. And you can do that and plan the trip out in the event that you have an emergency with your pet during travel.
Absolutely. I think we've all seen the client who's traveling. I know certainly here in Florida, like you mentioned, we get snowbirds and exactly what you said, we run out of a pet's medication and or there's an exacerbation of a chronic condition and they
Mhm.
come in and you say, "Okay, what medications is your pet taking?" and they have no idea.
It's the little white pill to cure the sickness.
Right, right. And you're like, "Okay, I have a few of those and they all do different things and we want to
Right.
pick the right one." And that's something so simple that you don't necessarily have to say, "Okay, make sure you do X, Y, and Z before you leave," but to hand them this envelope and their records and have these sorts of, "Hey, did you think about these things before you left?" Then they can take that home and sort through it and have that information. And gosh, wouldn't that make our lives easier in veterinary medicine if someone showed up with records and medications and dosages, and if there was an exacerbation in an unfamiliar area, we could take those records and say, "Okay, I can take it from here and get you through, to get you home."
Yeah. And I used to work in Colorado, and sometimes there are medical conditions that will not do well in other locations. So we would
Right.
have animals fly on their private planes from Florida specifically up to Vail, Colorado to go skiing. And suddenly a dog that does great at sea level, has pulmonary hypertension.
Right.
And then suddenly they're gasping for breath because of the barometric pressure is low and the oxygen is low, et cetera. And so, sometimes the veterinarian has to be an advocate saying, I don't think it's great that you are considering travel to a specific location. And it may be challenging. I think that oftentimes the clients are more disturbed of not being with their pets than the pets care about not being with their people.
Sure.
But, we just want to keep them healthy. And that's where giving a clean bill of health, because if it's a private jet, they don't need a health certificate necessarily.
Right.
So just things to think about if you have affluent clients that are jet setters that go to place.
I actually just recently learned about pulmonary hypertension being this big concern at altitude that we don't see at sea level. I've lived at sea level my whole life. And
Yeah,
I was just talking to my team yesterday. We had a few anesthetized procedures. And I said, when I did the NAVC Institute course, our instructor was from Colorado State. And she made me laugh because she said, "It's so weird anesthetizing dogs here in Florida because they
yeah.
don't turn blue when you induce them." And we all went, "What? What are you talking about?"
When
And I
when I
guess that's a
moved,
thing in Colorado.
it is. I moved there and I saw the blood gases, and I wanted to put everything on a ventilator based on their
Right.
PaO2. Certainly, we didn't, but it took some getting used to. Blood gases at sea level are way different than at altitude.
Yeah, it's a good consideration that I think those of us at sea level need to really think about to say, "Oh yeah, enjoy your trip," but to think about the exacerbation on some of these comorbidities.
Yeah. And even animals that have respiratory compromise and they're bringing from a cooler environment to a warm environment, or in a location that doesn't have much heartworm, and then you're going to Florida or flea and tick preventative, and making sure that they're kept on those preventative medications as well is really, really important.
Absolutely. Absolutely. I think these are all good considerations that it can be easy to forget if you're used to practicing in one geographical area.
Mhm.
So we mentioned snowbirds coming to Florida, and that is certainly a thing. I live about an hour and a half north of the villages, and so we get a lot of passers through coming in with their pets. And the heat is part of the issue, of course, in Florida. And add to that, the brachycephalics are now, the most popular breed in America, French bulldogs in particular, Hyperthermia is something that we see as a big issue here on a regular basis. So I'd love to hear your thoughts on kind of what you've seen and that client communication piece and the message for us as a veterinary community when it comes to injuries from hyper and hypothermia in dogs and cats.
Yeah, so brachycephalics are near and dear to my heart. I've had pugs for over 2 decades, and I have two brachycephalic cats. And so they cannot tolerate heat or overexertion in the heat. And so walking them at only the coolest portions of the day, keeping them in air conditioning. But what people don't recognize is that even in an air conditioned car or a heated car, an animal could overheat or get too cold. And so I see cars that are idle with the engine running within it. There's a sign. I know my dog is in here. The AC is on. Don't worry. And a dog could inadvertently turn the knob and get heat stroke from being in an air conditioned vehicle because they're loose in the car, which we don't recommend, and then they knock the knob. And there was actually a Newfoundland, who is not a breed traditionally that has problems with heat, that it was in a vehicle in the winter in Canada and knocked the knob up where the heat was on, and the dog got heat stroke. Similarly, a dog could turn off the heat and get hypothermia. And so I think hyperthermia is the worst. And so any recommendation that a pediatrician would tell parents, like, don't leave your baby in the car alone, I would say, same with your pet. And so plan accordingly. If you have to travel with your pet where you think you have a couple of stops along the way, either leave them home if you can or have someone with you so that they can stay in the car and make sure the pet stays safe.
I know I've certainly, my dogs will come to work with me from time to time. From time to time, they come to work with me all the time. So if I'm running home, I try to do, thank goodness for like curbside pickup, right? That has just
Yes.
changed the game. And I really try
Uh-huh.
to do that. But every now and again, of course, you can't. And I've certainly been guilty of, okay, let me run in here and pick this thing up for 5 minutes. And I keep those trips short. But certainly things can happen very quickly. And I remember seeing, I want to say it was like a Facebook ad or something, and it was a store and they had this area with air conditioned dog kennels in the front.
Oh,
And you could,
wow.
if you had your dog, you could put him in the kennel and then you could go do your shopping and come back and get your dog and they didn't have to stay in the car. And I went, man, for those little, like, I don't have a choice. I can't do curbside. I have to run in. Man, that would be nice. And I have so many mixed feelings on vaccines and parasites and all of those things. But I went, man, that would be convenient.
Exactly. It's kind of brilliant if
Yes.
if they clean out the Kendalls in between.
Need to get like a UV light in there and just, zap it every time or something. Who knows?
Yeah. Yeah. I frequently see animals in Home Depot. Like Home Depot allows dogs and cats in.
Yeah. So do some of the grocery stores. And I don't love seeing a dog's nose in my cheese when I'm going to pick out like
True. True.
oh, that's another now I'm digressing, going in a whole different direction.
That's a whole other issue.
Exactly. Well, I think you have done a great job establishing that there are some real concerns related to vehicle safety and our pets. And inevitably, we have seen and we will continue to see these cases to a degree, hopefully a much lesser degree, if we all work together as a community and get these safety messages out there. Are there any tips that you can offer to the veterinary community so just we can be more prepared for when we are presented with cases like this, like trauma, heat stroke, things like that?
Yeah. So trauma and heat stroke and anything doesn't necessarily happen just because they're traveling in a vehicle. And of course, it's the busiest time of day. And so I would say just keep up with the CE. There are so many great online and in-person resources, as well as textbooks on hyperthermia and heat-induced illness, laryngeal paralysis, brachycephalic airway syndrome, the traumatized patient, head trauma. I can go on and on and on. And it doesn't necessarily have to be an emergency critical care specific conference. North American Veterinary Conference, VMX now, is a fantastic conference that has a wide gamut of topics. Western Veterinary Conference is also fantastic. And also the Veterinary Emergency Critical Care Society and IVEX. IVEX is coming up at the end of next week. And so that's my home away from home. And if people can't attend, there are a lot of online resources just to keep current in the best how to approach those scenarios, and also train your team to recognize what an owner is saying, based on clinical signs if an animal is having respiratory difficulty or harsh breathing and just buzzwords. That if the person is calling or a first responder is calling saying that they have an animal that's been thrown from a car, your front desk is the first one to answer the phone. And so training those people to get those animals into the nearest facility, not necessarily yours, that could at least initially stabilize them and then determine if they're ill enough to require 24-hour care and referral elsewhere.
I love that you said that, to get them to the closest facility, not necessarily yours, because that would be another natural instinct, I think, is, yeah, sure, bring them in here. We'll see them, we'll do everything that we can. But I mean, we have the internet, right? We have Google. So there could be some training there to say, okay, where are you located? Tell me, and do a search and say, okay, you're welcome to bring them here, but here's a facility that's closer to you. Here's an emergency clinic that's very close to you. Take the animal there instead, to really get the best care for the animal, which is of course the intention with the yes, bring them here. But if, they might be farther away and there might be a better option that's a little closer.
Yeah, and I do consulting for a group called Critical Consults, where people could call us, veterinarians can call us, and 24 hours a day, always get someone within 20 minutes of calling back or immediately to ask about an emergency and critical care related case. And I've heard time and again, especially since COVID, that there are emergency facilities that are at capacity and cannot handle another intake. Even if they show up at the door, they've been turned away. And I hate to hear that.
Right.
It just hurts my soul. However, always having the client or the first responder or the veterinarian who is making that referral to that emergency clinic call ahead, make sure that they have enough oxygen cages, or whatever, just to make sure that they know the animal's coming and yes, they can do what this animal needs.
I think that's really good advice. We've seen that, and gosh, I'm lucky to live right outside of Gainesville, and
Yeah.
you throw a rock and you hit a clinic, and we have multiple emergency and
Wow.
urgent care
Mhm.
options, and it's great. But even with all of those resources, we've had our emergency facilities hit capacity and not be able to handle the cases. And so I think that's really good advice, to call and make sure that you're sending them somewhere where that animal can get the care, because otherwise you might just be inadvertently delaying care further.
Exactly.
I want to go back real quick to what you said about textbooks.
Mhm.
I'm wondering quick references and I want to hear more about critical consults, because that sounds like a really great resource. But I guess that would be my question, is kind of quick references. Are there any that you recommend when we're faced with these cases and we just need something where we can flip through and get some quick answers?
Sure. Since you asked, I will tell you, plug my own book. It's a clinical companion to the 5-minute veterinary consult specifically for emergency and critical care. And so they're bullet points, how you deal with
Love
injuries
it.
and things like that. For more in-depth things, I would say Ettinger's is always a great resource. And Silverstein Hopper, textbook of veterinary emergency critical care, is sort of like our veterinary and critical care go-to for in-depth, physiology. But I would say any of the 5-minute veterinary consult specifically for emergency and critical care, I was the editor for that one. And it's a go-to resource for things on the fly.
Okay. Okay. Absolutely. I think those are great resources. And then tell us more about critical consults. Is that something that's available nationwide?
Yeah, nationwide in Canada. Well, it's actually worldwide, I guess, because they have
Wow.
they have to call us, right? And it's a 24-hour service. There are about 8 critical care specialists. It was started by Dr. Amy Butler, who's a criticalist. And basically, we take 12-hour shifts and we answer the phone at all hours. And you can call us and present a case that you're dealing with. We ask the history, the physical exam findings, what you've done so far. Sometimes people can send us radiographs or an EKG or the medical record, and then we'll call you back. But often we do it in real time. We go through all the blood work abnormalities, et cetera, and then we'll come up with a treatment plan according to what we think is going on based on what you tell us, what our recommendations are, and say, oh gosh, Maz, I don't have that opioid. We don't have fentanyl. We have buprenorphine and methadone, or we don't have that drug. Is there something else? And so we tailor our recommendations based on the resources that the hospital has in the moment. And then we've had cases where animals hospitalized for 3 and 4 weeks I can think of one recently. It was a hypocalcemia case after a parathyroidectomy, and we helped manage the nuances of treating that patient's hypocalcemia. That was, I think he had 25 or 26 consults.
Wow.
And then we tag off to the next consultant at the end of our shifts. Hey, I think that such and such from this hospital is going to call back. And we keep our files in an online source that all of our consultants could read the initial consultation and then be up to date and then take off from there. So I learn more from the consulting and working within the resources of each hospital. And I love helping people. And some people will call and say, oh my gosh, I have the most stupid question. And I was like, there's no stupid question. And I think it's a resource for phoning a friend. Just phone a friend, and so when I don't know something, I reach out to the other consultants, and we have this group text going on almost all the time. We have consultants in the Pacific Northwest, for example, and I live in Connecticut. I haven't seen salmon toxicity and salmon poisoning, but she sees it all the time. And so it's like, oh, I got a call from Portland. I think it's salmon toxicity or salmon poisoning. What do you think? And so it's a very fun for me service, and it's available. We have clients and hospitals in Canada that call us, as well as all over the United States.
This is very cool. I just Googled it as you were talking, just out of, my own curiosity, because it's the first I've heard of this. And
Mhm.
what a necessary service, especially here we go. We're gonna go down another rabbit hole, try to keep us from going too far down the rabbit hole, but rising costs of veterinary care and
Yeah.
emergency rooms that are at capacity and can't take on additional patients. I mentioned living right outside of Gainesville and having a lot of emergency resources available. That doesn't mean I'm able to refer every patient. And sometimes, I'm really having to work with my hands tied in a lot of ways, but
Mhm.
I have found that it's amazing what we can pull off without all the bells and whistles and without having every resource available. So this seems like something where, like you said, working within the confines of what we have, it's amazing how well animals can do in that scenario with the right treatment plan. And of course, we need guidance to help us figure that out. So I'm so glad we talked about this. I do you mind if I share the phone number to it? I feel like that'd be a really good resource to have out there.
Absolutely. We're coming up on IVEX, and we're always busier during IVEX because all the emergency people go to IVEX. So please share the phone number. We Last week I had a case where the animal had to travel 4 hours, and there were still several hours from a university tertiary referral hospital.
Wow.
And the animal had an upper airway obstruction and laryngeal edema. And the veterinarian said, gosh, I've never done a tracheostomy myself. And so I was able to walk her through a blind intubation and then send her. We also can send resources with photos and things like that to help guide people do a tracheostomy if they have to in an urgent situation. And so we love it when we have to look up things and then send literature, and we learn at the same time.
So cool. Because, yeah, I mean, I have done tracheostomies in a lab situation. Like, I've been
Yeah.
trained how to do it, but I've not
Mhm.
in that, adrenaline squeeze, like, oh my gosh, this patient's life is in my hands situation. Man, would it be nice to just have somebody kind of looking over my shoulder and saying, like, you're going to be okay. Here's how we're going to do this. And just
Mhm.
that reassurance that someone else is there with you.
Yeah, and this is a off topic and whatnot, but it's coming out probably. It might be there for VMX in January. Tim Hackett and I wrote an emergency critical care procedures step-by-step manual. So it's photographs that take a person step by step through all the emergency procedures that I do almost every day, but in a busy general practice who fortunately sees a lot of healthy animals, if you're not used to placing chest tubes or a tracheostomy or things like that, it walks a person through the steps as well as gives helpful hints on where you might get a little glitch in the system and how to troubleshoot it in real time.
Very cool. Very
Yeah.
cool. And I said I was going to share this phone number and I never did. It's super easy. It's 1-844 need ECC. So NEED ECC. Like, super easy to remember when your epinephrine is through the roof and you can't remember anything. Just a call. I'm so excited we talked about this as a resource.
Yeah. Yeah. So yeah, I have an overnight shift tonight, and I love it. I actually love it.
That's awesome. That's awesome. Well, Maz, this has been such a neat conversation, just full of helpful tips, things that maybe we don't think about on a day-to-day basis when it comes to vehicular safety and communicating that with clients, but also, man, what a list of great resources for helping us manage those emergency cases that inevitably will come in. So I want to say a huge thank you to you for joining me and for all the great information. Any final thoughts you want to share with us?
I think just the topic of we're all in this together. And so, we can help each other out and just help the animals. And I always end my lectures, save the smushies,
Oh,
because I have my brachycephalics, save the smushies.
I love it. Save the smushies. Yes, absolutely. They sometimes need a little extra help with the saving. So
Yeah.
work hard on those guys.
Exactly.
Well, Maz, thank you again.
You're very welcome.
What an interesting episode and really unexpected. Like I said, I really didn't know what to expect when this topic came about, but Maz was such great conversation. And I feel like I walked away with fantastic information and resources for just how to approach car safety more effectively going forward. I want to say a huge thank you to Maz for joining me. Thank you to all of you who tuned in. I really hope you enjoyed the episode. If you did enjoy this episode, please leave us a 5-star review wherever you get your podcasts. It'll help other veterinary professionals like you find this and other great content we try to put out there. For more episodes like this, click on the Education tab on the VetFolio website. As always, we'd love to hear your input on this talk, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassi DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.